Hey, good morning. Welcome everybody to the Self Care Saturday Show. I'm your girl Tracy Williams with Inspiring Hope, which stands for having only positive expectations through true self care. So if you heard me say that, remember that because there might be a little prize for you at the end. So come on in, everybody. Grab your favorite water, coffee, or tea. Or if you like me, you like hot chocolate too, with a little pumpkin spice in there. Never hurts. It always helps. I love pumpkin spice. What about you, Annette? You like pumpkin spice?
I do. I love coffee. I love tea. But I've been putting my pumpkin pie spice on in my coffee the last few days. So, woman of my
Awesome.
heart, yes.
Awesome. One of my favorite things about Quick Trip. So I'm glad you guys are able to join us today. As you join in, make sure that you share because sharing is caring. Invite your besties to come with you and check it out. If you watch this on a replay, make sure you put in there hashtag replay so we know that you did that. So that'll be awesome. And as you join, if you have a business, please put your business name in the box. We want to know where you're from. If you're from Kansas City, Overland Park, wherever you are in the world, let us know. I have a great guest with us this morning. I love her energy. Every time I call her Miss High Vibe because her energy is infectious, you guys. She's always smiling and hugging, and I'm a huggy duggy kind of girl, so I like that kind of stuff. So I know some people are not, but when they meet me, sometimes they change their whole tune because I don't know. I have that I'm on this 8 to 10 thing all the time, so I guess that's why I go to bed early at night, right? But the time when it's time to go to bed, I just get into bed and that's it. But thank you for coming to the Self Care Saturday Show. Today is going to be a really important topic, and it's something I feel like we really need to talk about more than once a year. I know we have Cancer Awareness Month, but I really think for us to stay aware of something, the more we talk about it, then the more conscious we are. So the higher our conscious level is on that subject. How you feel about that, Miss Annette?
It is so important. More than ever, COVID has put a lot of dents in lifestyles and things that we do. And unfortunately, self-care is one of those things that have gone to the side because of the environment that we're in. Is so more important now more than ever to take care of ourselves. So absolutely.
For sure.
In education, I think that if you have a platform and you're okay with being in the public, which I am, but education is key because I have found so much information through my journey that everybody needs to know things that I didn't know because it wasn't in my wheelhouse. It wasn't something I had to deal with. Yes, I've always screened. I have mammograms since I was the age of 40. But if you have this information and you put in the situation where you can share, this is key because what we're going to talk about today can save your life. I mean, it sounds pretty dramatic and drastic, but it can, you know.
Mm-hmm.
So it's and the life of those around you, because we are all vessels for information. And it's funny how when we are educated on a certain area, we start noticing more signals coming our way, right? It's the energy we put in the universe comes back. And it's funny. I mean, it works really weirdly in Facebook, but that's a different topic. But you start seeing a lot more things coming your way. So
Exactly. Well, I'm so honored and privileged that you're here today. So again, if you're catching us on the replay, make sure you put in hashtag replay so that I know that you are here. If you got a business, throw that in the box so people will know. If you're watching us from YouTube, welcome YouTube family. So excited that you're here. If you like the information that you're getting, make sure that you hit that red subscribe button and hit that little bell so you can get noticed every time we jump on here. I'm going to jump into telling you a little bit about Miss Annette and let you tell her a lot about herself as well. But before we get started with that, we're going to get to know her a little bit. So we're going to do one of my old school things I used to do when I first started and just ask some like pop questions. Okay.
okay, and this is the first time we've talked in a long time, so nobody got prepared here. So let's do it.
Exactly. That's what makes it so fun. I love this.
Right.
This is my polka dot sisters. So even though Kansas City polka dot is not existing right now, but who knows what's headed for the future.
Right.
But that shows you how real sisterhood can be. So let me ask you this. Annette, of all the drinks in the world, what is your favorite drink?
Are we talking boozy drink or just any drink?
I know you were gonna say any drink.
Oh, that's a hard one. I love coffee. I'm from Costa Rica. We have the best coffee in the world. So coffee brings a lot of memories too of childhood and my grandmother's kitchen and dipping bread with butter and coffee with milk. So that's probably the one that would resonate. Smell, sense, everything. Coffee. I love me some tequila, but coffee would be for sure.
I love it. Awesome. Any
Yeah.
special things that you like in your coffee that make it your favorite?
I do like some sort of creamer, and I have had graduated through the years being a health coach and going through my health journey. So I stick with like real stuff. Either, and by that I said either good old heavy cream, a little bit goes a long way, or like almond milk, or like, something with some consistency in it. So yeah, and almond milk's pretty creamy, but I love yeah, I like a little bit of that. I like black coffee too, and I love putting a little bit of pumpkin spice. So there we go.
Hey, that's what I'm talking about.
Right.
Yes.
Yeah.
That's one of my favorites. Cappuccino with pumpkin spice. Love to go to get that from Quick Trip. Quick Trip's one of my favorites because a couple of different reasons, actually. So one of them is because they always appear so clean. So I love that, and everything tastes so good. So yeah, and I mean, I like to mix it all together, kind of like they call them suicides. I don't know. Good morning, thank you for joining, Mr. Lisa, with Sisters Helping Others Progress. Hey, yeah, we got some other sisters in the house. That's awesome. Thank you for joining us. Make sure you share because sharing is caring. And we are talking about breast cancer here today, awareness and prevention, all kind of stuff that we can and what you can do if you do get diagnosed with it, or if you know somebody who is or was diagnosed with that as well. So please make sure you share this. If you're watching from YouTube, make sure you turn on your chat. There's a little thing on the right side. You have to hit it that says chat and to turn it on in order to chat from YouTube. So again, thank you for joining us. I'll just let you know, Miss Annette Dela Cruz. I like saying that. Norman. That's the normal part. Like she said, she's from Costa Rica. I love that, and I just love all kind of cultures and different things and different people and what's going on in the world today. And so I love those kind of things. But Miss Annette Dela Cruz, she's the owner of Fit for Chick Life. Fit for Chick for Life. Did I say that right?
Fit chick for life.
Fit Chick for Life. I should have read what I wrote, but
That's
Fit Chick for Life. And you guys can always get in touch with her on YouTube. I mean, on Facebook and on LinkedIn as well. She
and
has
Instagram
tons.
too.
Go ahead, say that again.
And Instagram too. It's fit chick for life. Mhm.
Yay! All right, thank you so much. So awesome. And the thing is, I love that how giving and caring she is about people and their health. She's really passionate about this. It's not just like a business thing that she does, but it kind of surrounds her whole livelihood when it comes to health. I know when COVID first started happening and we first shut down, Miss Annette was on that Facebook every day, almost every day, faithfully. I couldn't even keep up with her, of course. But she was on there, helping people do the Zumba because she does Zumba classes as well. She's been doing that for some years. And so I just think that's awesome. And so as the all around girl that she is, she also has another group that she co-founded and is a co-owner of. And I'll let her tell us a little bit about that a little bit later. And it's for people, women that want to be wealthy, that want to make some wealth, and who doesn't. And if you don't, talk to me afterwards and let's talk about that, where your mindset is for money.
Absolutely.
Okay. So I thought this was really important for us to kick off the beginning of the year talking about our physical health, because our physical health, it really helps set the tone for other things in our life. And so, of course, we are going to talk about spiritual health and all those kind of things, mental health and all that this year. But this is important to me to really talk about our mammograms and things like that. So One more surprise question we want for you. What is one of your favorite, just fun to do activities? Oh, wait a minute. Besides traveling all over the world.
Haven't done a lot of that lately. Other than that, and dancing, dancing is one of my favorite things to do. Before I even taught Zumba, I love to cook.
Ooh,
Mhm.
awesome.
Yeah,
Awesome.
I
Okay,
love
what's your
to feed people. I love to cook. I think that's a Latin thing too, but I love to cook. Yes.
Yes. All
Yeah.
right. So tell us a little bit about your journey with being diagnosed with breast cancer.
Yes. So, um, I struggled a little bit with how to compartmentalize the diagnosis because I felt almost so lucky that I feel guilty. So here's what happened. I went for my mammogram and mine was a couple of months behind because of COVID. I was scheduled to go when we were at the stay at home. Not that that would have changed the diagnosis, but I'm telling just mindset, right? So I was supposed to go somewhere in May or April, things were closed. And then I went to my regular OBGYN checkup in June or July. And that's when he said, when was your last mammogram? And I'm like, oh crap, pardon my French. It was supposed to be during the quarantine time. So I called, I did go to Colorado and I set up an appointment. I always make these stories so long. So I'm going to shorten it out right now. October, Breast Cancer Awareness Month. I go get my mammogram and got called back. So, yay, mammogram last week. I love it. They said come back. And I had a biopsy 2.5 years before for calcifications of the breast, which is normal. It happens to me. I went to my regular screening. I didn't have a lump, no symptoms, nothing, just regular screening. We did that biopsy and I was diagnosed with what's called DCIS, stage 0 breast cancer. So to simplify it, if you haven't gone through this, what that means is it's in the duct. It's non-invasive. So ductal carcinoma in situ, which is inside the duct, in stage 0. If you are going to get a call, and you don't want the call, I'm just saying, but if you're going to get a call that you have breast cancer, this is the call that you want. It's in the earliest stages. It hasn't left the duct. It's inside, is contained. There's 100% chance survival rate. So my life is not a danger. It's more, will it come back? That's when you talk about non-invasive or even cancer, you talk about, those things. So I flipped out, did all the emotions, and we can talk more about that in emotions and mental health because it's so important. But that was a diagnosis. And I had two options, 5 millimeters, by the way, very small. I had lumpectomy, which is they take the cancer, the carcinoma out, with possible radiation, or a mastectomy. So not to diminish anybody that has a mastectomy, because this journey is a very personal journey. You have to get educated. You have to understand what's happening. And at the end of the day, only you can make that decision of what's comfortable. Doctors will always give you options. I had a lumpectomy in December, clear margins. So that part is done. And now I'm evaluating whether radiation is needed or not. And again, I think what I've found through this journey is that you are your best health advocate. You have to ask questions. Because they'll tell you, a doctor can tell you, you need to do A, B, and C, and that's fine. And you'll evaluate that. But there's always going to be options within, let's say 1, 2, and 3. There's always going to be a 1A, a 1B, and a 1C, a 2A, a 2B, a 2C. So always ask questions. Probably the best gift I was given in life is that I ask a lot of questions and I talk a lot. So I'm always going to be asking questions.
Yeah.
And in the health industry or in helping people with their health, including changing my life over the last, 12 years and before. So I'm very well versed, maybe more than the average person, on, a lot of health stuff. So I asked a lot of questions, but what I want to bring it back to, and then we can go into what people can do, is this. Mammogram saves lives. I mean, bottom line, they save lives. If you're 40 or over the age of 40, you should have a yearly mammogram. But here's the thing. I have what's called dense breasts, and we're gonna put some information after this. So there's 4 types.
Hold on, because I want to know about that dense breast. Because a lady, mentioned that to me before, and she said a lot of times people don't understand what that actually means. So can
Yes.
you just kind of explain to us that about what that is too?
It's very important and it's very common. So we have four types of breast tissues. They're labeled from 1 to 4. One is there's no density in the breast, and 4 is super dense. And so the best way, and like I said, we'll post some pictures to put a non-dense breast with a dense breast is if you've had a mammogram, you know what I'm talking about. You can see through the picture that it's clear, kind of like water with a very few variations. When you have denser breasts, a 3 or 4, there's cloudiness. Think of like a web, or like a tie-dye shirt. Let's say you have a gray shirt with white tie-dye over it. So now think of that in a mammogram that's trying to see through the dense breasts. This is where 3D mammograms are huge. I think most right now are covered by insurance. If they're not, the additional cost is like $59 or $60. The best $60 you can spend if it's not covered by insurance. But I think now they're covered by insurance. What happens with dense breasts is unless you do a 3D, it's really hard to see spots early on. I had a dear friend of mine that 8 years ago got diagnosed with stage 2 because until 3D mammograms were available, they couldn't see it because it's cloudy. Think of a dense breast as something that's cloudy or foggy and is hard to see through.
Oh, okay.
So 3D mammograms is important. Now, I have what's called microcalcifications, like a dot of a pencil. I would have never felt it. I didn't feel bad. I exercise. I'm healthy. I mean, I have everything going, in that direction. So it's nothing that I would have felt. By the time I would have felt a mass, it could have been too late. So that's
Wow.
why you got to check your tatas. It's the most important thing you can do. And yes, self-exam at home is super important as well. But yearly mammograms save lives. I mean, that's 1 in 8 women will be diagnosed with breast cancer. What is 85% have no family history. I don't have it. I actually, funny, interesting story. I am adopted. I found my family found me. My birth family found me this summer, so I know there's no birth history, and I've done genetics for it as well. So 85% is no family history. Most people think that it's family history driven. And it's not. And then 93% of those diagnosed with breast cancer will survive breast cancer. So it's not a death sentence. Things have improved so much in prevention that we can avoid doing that. Tracy, I think I lost you.
Oh, I'm here.
Oh,
Yeah.
there you are. Did I
Yeah.
lose you there for a moment?
Yeah. No, yeah, I'm here. Totally here.
Okay.
So that's interesting to know about the 4 different things that you share with us. So I have a question. So one of my big things is, I know you were saying it's important to ask questions, but sometimes we don't know what to ask. So what in the world do we ask? You know?
Well, you mean if you've been diagnosed with breast cancer?
Yes. Or yes, for sure.
Here, there's stages of this. And the first is you freak out. I mean, I freaked out. Who doesn't freak out?
Exactly.
And it's not denial. I think it's just shock. We all we all deal with those things. So at first, you're gonna, and I'm a very anxious person to begin with. I am so full of energy and stuff, but I'm also, tend to have high anxiety. So maybe it comes with the territory.
I'm
So
right with you. So I get it.
I was asking questions like, interesting with COVID, like my husband necessarily couldn't be there in the room, but he was outside on the waiting room with the phone. So I always need to have somebody with me, listen, because we are the ones dealing with it. We're in shock. Not that my husband's not dealing with it, because the whole family does, but it's good to have somebody that's listening in that is other than yourself, because you're going to have a fog. I'm going to tell you that. It's foggy. You're stressed out. As I went through those emotions, but you will know what questions. It's not that I can tell you what questions to ask because they're very thorough, But I
Mm-hmm.
think you should always opinion, if that's, or a third opinion, because I love my doctor from the beginning. I felt comfortable, very thorough, explained. I asked every questions. Nowadays, they have nurse advocates that work in your favor. So I think you have to find a place that you're comfortable with. In asking the questions, I think it's something that comes with understanding your diagnosis. So I can't tell you that I know the answers to what questions to ask, but it's what options do I have? What is the chance of recurrence? What does this mean? Do I need to do genetic testing? And I would say yes, do genetic testing. I don't have BRCA. I don't have any gene mutations. I don't have any of the above. I don't have a mom or a sister or anybody that has had breast cancer, just to give you an idea. Um, what are my options? And as you talk, like I had to talk to the radiation oncologist, is options there too. Nothing, rarely is everything 1, 2, 3, and done. And you can do that, but it's not always that simple because there's always options. And the breast doctor, I call her my boob doctor. My boob doctor, which I love, is not necessarily the best person to answer your radiation questions. Is your radiation oncologist. We're very lucky in Kansas City to have a naturopath oncology clinic. And
Oh,
in conjunction with my conventional treatment, I'm doing naturopath oncology too, because that's very important to me to know that. Here's the thing. So in questions, asking questions is sometimes people say, well, why did it happen to me? Why was it? You kind of feel guilty. You kind of feel, what did you do in the past? It doesn't really matter at this point because you've been diagnosed right now. So you can't change the past. But what I tell you is that we do have control of the future and the present. So it's not like necessarily you drew the unlucky card and you have breast cancer. I mean, 1 in 8 women will be diagnosed, but there's definitely prevention things moving forward that you can do to reoccurrence. That's where I'm at. My life's not in danger, but what is the chances that it'll come back in the next 5 to 10 years? So if you think my journey, this is the best way to explain it. If you think of non-invasive cancer, which is what I had, stage 0, there's a weed growing. Okay. So the first step is how do we remove the weed? So think of your yard, you're going to a dandelion and you remove it. And we know that we can't just pull the flower, we got to pull the roots, right? So we want to be very careful. Now, what happens if you didn't get every little tiny little root? It can sprout again, right?
right, exactly.
So the first is pulling the weed. And by the way, I think I read this from somebody. This is not my brilliance coming with this analogy, by the way, but I love it because it's very easy to understand. So the next step is like putting a chemical, which I hate chemicals and I don't do a thing, and I hate Roundup, but it's the best way to explain it. You can spray some Roundup where that weed was to kill any roots that are left to avoid it from coming back. That's what radiation does. And radiation has its own side effects and things. So, we got to remember that too. But that's the second step. But what if we don't treat the soil around it to keep the weed from even coming up in the first place? Because for a weed to come up, the soil has to have either more acidity or less acidity, or it has to be an environment where weeds can survive. But what if we treat the soil everywhere else so weeds don't have an opportunity to ever grow back? And this is what happens if you just treat any type of cancer, like let's say breast cancer, and you do radiation and you treat radiation in your boob, but what about the rest of your body? See, recurrence is not only necessarily in where you had the cancer. If your environment and your health is not such, if there's not a change, that means you're more prone to have those mutations of cancer, and it can show up somewhere else in your bones. And this is not to freak anybody out, but this is where education is so key. Right. And I think for a lot of people, this is going over your head. And a lot of people are so afraid that they say, get it out, do whatever you need to do. And that's okay because you do want that out. But what can you do moving forward so that environment is not there for it to come back? And that's, to me, where the education and the naturopath oncology comes in line with conventional. This is not woo-woo unproven stuff that you can cure cancer naturally, even though a lot of people do. But what I'm saying is, it's what you're comfortable with doing. It's education and knowing that there's options to improve your health to be optimal.
Yeah.
Uh, I had a
Thank
doctor
you.
that
Because you
told
know
me,
what? I
uh-huh,
never heard of a natural oncologist, so a naturopath oncologist. So I'm sure somebody else probably has not either. And so that's a good answer right there. If somebody can, would you put that in the chat for me?
mhm.
Is that what it's called? Naturopath oncologist.
Oncologist. And in Kansas City, which a lot of you are watching from Kansas City, we're lucky to have a clinic. It's 3 minutes from my house, and I didn't even know it existed. And it's
Okay.
because a friend of mine that went through breast cancer goes for other things there, and she recommended, my friend Carrie recommended this naturopath oncologist. It's a clinic that's been around in Wichita, Kansas since the 70s. So this Dr. Lucas Timms, and I'll put the name, he worked for the Cancer Treatment Centers of America for over 8 years in conjunction with conventional treatment. So whether you choose radiation and chemotherapy, you still need to boost that immune system back to do what it's supposed to do. So it's important to have well-rounded care. Does that make sense?
Yes, of course.
And again, information to me is the key to anything, whether we're talking about cancer, whether we're talking about wealth management, whether we're talking about exercise. It's just educating ourselves to understand choices and options that we have to improve our health. Because I don't want, nobody wants cancer to come back. And I was lucky enough, I guess, in the sense to say I had my screening, it was caught early, but the prognosis is recurrence, and you have a higher chance of cancer coming back in the first 5 to 10 years.
Okay, yeah, I didn't want to hear that, but yeah, you know what? I'm glad that you said that. We do feel that scary feeling even anytime we hear the word cancer. And I remember my dad used to say, because he was diagnosed with cancer, but he used to say, he said, "Oh, baby, cancer is not like it used to be. You know, there are options. They can do different things now, so you don't have to be so scary." And so that's good,
And,
because
and I think because prevention has come so far in screenings, that that screening is the first thing, because I think there's a chart that we'll put, but it's 100%. If you have stage 0 or stage 1 of this is breast cancer in general, it's 100% survival. You're my survivorship's not at risk here. Stage 2, 93% chance of surviving. Stage 3, it's 72%. Stage 4, 22%. This is not by any means a death sentence, even if you're stage 3 or 4. It's just if screening was available and you can catch it when it's a stage 0, it's 100%. So this is where we're at. Check your tatas. I mean, if I leave you with nothing else, is if you haven't scheduled a mammogram, schedule it now. And if you did, post it in the comments and tell us know that you did, because there's power in numbers, guys. And as I had a couple of people, I have probably 12 of my friends that hadn't scheduled it because of COVID and things. And it's like, oh, I'll do it later. And as women, sometimes we put our self-care to the side to take care of other people. But you know what? We cannot take care of other people if we're not well. So it's not being selfish, it's being smart. In taking care of ourselves allows us to take care of other people better. And that's, as women, we're nurturers. We take care of other people. And there's definitely things that we can do. I mean, we can talk, we have other graphics we can post about, well, what about prevention? What can I do? And there's definitely things that we totally have control over. Just because we're diagnosed with cancer doesn't mean we don't have an options and control of what happens in the future. We totally, yeah.
Well, congratulations to all of you who have had your mammogram.
Yes.
Kudos to you. I have to admit, you guys, I haven't had one in 6 years. I called yesterday and made my appointment. Actually, I was supposed to go last month, and I just didn't. I forgot. Actually, I forgot all about it. I was working too much, and so I made an appointment yesterday. Thank you, because I didn't want to come on the show and say I haven't had it and I haven't scheduled one. So I wanted to be able to say I have scheduled, and so it's like in 2 weeks on a Saturday, which is perfect for me because Saturday mornings are a good time for me to lay in the bed and just chill and relax. And so this is really important. And I love the fact that you said it's going to be 3D so I can kind of see what's going on for myself. Like they have, and I think everything is 3D now. When the mommies get pregnant and they can see those
I
babies
know, I
inside.
know, right? It's so cool.
It's amazing. It's amazing.
Yeah. And here's the thing, Tracy. I think it's great, Tracy, that you share that you hadn't had one because there's no shame in that. Again, if we do nothing today but get this in your head, is that prevention is key, and to go get your tatas checked. I mean, it is so important. Um, I've had other friends that have been diagnosed with cancer, during this time, and I have. Okay, so my friend also said this. I think the number one risk factor is denial. If
Mhm.
you I had a scare 2.5 years ago, and it was benign. It was calcifications, which 80% of the time they're benign. And you have a little PTSD of having to go back and check. And what if I have to do another biopsy? Which I guess I rather have a biopsy. This is me than go to the dentist, but that's a different story. I hate dentists. So that being said, there's a lot of mind games that happen because we are scared. And I get it. I totally get it. I've been there, but it's so much more. If we look at the hindsight, if we wait 2 years because we're scared, or we wait 3 years, what if something did develop and now we're facing more treatment, more things? Our livelihood is at risk more than simply going and having something done that may be a little bit uncomfortable. It lasts what, like 5 minutes? It's not really that uncomfortable. I don't mind getting my boobs squished, so maybe I'm weird, but it's short lived.
Oh my God. I thought the first time I got it done, I was going to die. I was like, hold on, I don't have that much. And you're like,
So I'll give you a piece of advice, and I haven't had a period in 3 years, so I'm I'm in the menopause area, but is don't go a week before, a week after your menstrual cycle, because you'll be more tender. So try to go, a week after that, if that helps people that are still, having their cycle. So that's important.
okay, good to know.
Oh, and by the way, there's a misconception too. Most people think that after you have menopause, your risk of breast cancer decrease. They actually increase. There's more people diagnosed with breast cancer, over the age of 50 than I'm 53, than younger. Now, when you're diagnosed younger, it tends to be more aggressive than when you're diagnosed, older. But again, I mean, I go back to that phone call, and hearing the diagnosis, but the two things that stuck with me is non-invasive stage 0. It
I
could have been
love that. Yeah.
a lot
So
worse.
I'm glad that's the news that you got for your diagnosis is non-invasive. But yeah, and I guess I was a little scared to go back because the first time I went, they were like, so do your breasts normally feel like this? They're asking me these questions and I'm like, yeah. And because I had never been there. So if it's your first time, or if you have a daughter, it's your first time, or a granddaughter and their first time, they're going to ask them questions. So I think it's important for us as older women to kind of prepare them and let them know, what to expect.
It,
And that's why I asked, Annette, even like, what kind of questions can we ask, or what kind of things can we do when we first go? And so we're going to go a little longer than 11:15, you guys. I hope you don't mind, but this is really important for us to actually start this year off just being healthy more than having fun or more than setting goals. This is one of our most important goals is you got to be healthy if you want to be wealthy. Me and Annette were talking about that a little bit earlier today. So I know we all have businesses and things like that, but to do those things, you got to have your health. And so we're going to go a little bit longer. So anyway, and it's just a thing that we need to be doing in the first place is being an example for those younger women in our lives, whether we know them or we don't know them. I don't know, the era I used to come from, it didn't matter if somebody was your mother or your auntie or whoever. If it was an older lady and she had some information to share with you that was wise, she sure felt comfortable sharing that with you. So make sure that you share this information and encourage the young women to go and get their tests every year so they won't be scared like Chicken Me was, and or they won't just put it off. and know what kind of questions to ask, know what things to look for or not look for. So this is some really important information. I am going to share these pictures. We were looking at them before we jumped on here, so that you guys can physically see. I know that you can process things like 100,000 times greater when you see something, and when you see it in video as well. So thank you so much. Oh, okay. Thank you. Thank you. Oh, that's cool, Carrie.
Oh, this is my dear friend, Carrie, breast cancer survivor. She's amazing. And she's the one that recommended the Reardon Clinic where Dr. Lucas Timms is. And again, such a amazing opportunity for information, knowledge, education, and to take care of our bodies. So Carrie's been great. There's also a great book, if you've ever, that she gifted me, that if you're dealing with cancer yourself or anybody you know, it's a 365 days of inspiration, encouragement, and action steps to survive and thrive. And it's like a devotional, or that you could read. There's something every day of the year to read.
Who is that by?
Huh?
Who is that by?
His name is Chris Wark, and he's a best-selling author of Chris Beats Cancer. And he was a gentleman, 26-year-old, diagnosed with colon cancer, which is super, super young, who actually beat cancer naturally, which is incredible. But he's just a pretty cool guy, interviews a lot of people on YouTube. And it's just, there's a lot of anxiety and a lot of things that you deal with going through this, and just reading something positive. I mean, one of them is just make sure you move today. Actually, Carrie sent me something today that one of the things, it says physical therapy, and it said to make sure you do Zumba or jazzercise or something. And I'm like, there you go. Move your body, get that stress out of your system. Yeah.
And you know what? I had another friend. She was diagnosed with stage 3 cancer, and she had cancer in both breasts. So she had a double mastectomy or something like that. But what was amazing to me was she, like you, she was like fully, you would think that she's like fully in health because she has a health center. So she does exercises every single day of the Monday through Sunday, you guys. And I don't know, like everything, your eating habits and all that kind of stuff, but everything in the environment plays an important part. And I think that to me was why it was important to have Annette on here, because like I said, this is like her 24/7 thing. I know that she is a big believer of going green. She does Melaleuca. We didn't even mention that before because she's not out here to try to sell you anything. But if that is something that you're interested in, is, Melaleuca, or like having your household be more, especially if you have pets, because I have 2 little dogs that they try to get into every single thing. I think they would be mops on the floor for me if I just let them. So I have to be careful of like what I clean my house with, and what we smell and stuff like that. So I think that's important. Tell us just a little touch about how Melaleuca can help with that.
Well, it's fun. Let's talk about prevention. And most people say, like, you think about, okay, I'm a fitness instructor, I teach, I've getting the toxins out of my house for the last 13 years, I eat pretty healthy for the most part. I think cancer doesn't discriminate in the sense that you could do everything perfectly, but still may be something off in your body, and you may know what it is. So don't feel guilty. Don't go back and, and torture yourself for what you could have done. But here's prevention, and this is where, what I do, which is educating people how to get the toxins out of the home and live a healthier life. Prevention is key. So getting environmental toxins, getting toxins out of the house is super important. We may not be able to control the air outside, but the EPA states that our air and our toxicity is 5 times worse in our homes than it is outside. And we can't control everything outside, but you control what you bring in your house. Exposure, like plastics, drinking out of plastic bottles and BPA, that's a high hormone disruptor thing that we need to eliminate. And think of a water bottle as a convenience, because you can't pour yourself a glass of water, right? So think of plastic in that sense. It's a convenience, maybe when we're traveling. Food, the foods we eat, not eating a lot of, processed foods. I mean, that's been shown to elevate these are all risk of cancer. Alcohol is a high risk, especially for breast cancer for women. I mean, alcohol is a high risk for any type of cancer, but now they say, drinking no more than 3 drinks a week for women is the line. So alcohol is interesting how it highly increases your chances of breast cancer. So just know that. Now, I'm not telling you drink or no drink. I'm telling you just the facts. Exercise is huge for prevention. And obviously, I'm a fitness instructor, so I love to teach. And then being at a healthy weight. If you're obese, is the number one two reasons for breast cancer and cancer is obesity. And it's also, smoking is another one. And then alcohol is in there too. So no, and I love tequila. I love a glass of wine. Just being knowledgeable about prevention in general and what it does. But what I've done with Maluka for the last 13 years is that I'm a very passionate educator, and I think education is key. So it's more just making people aware of the small changes they can make in their life that are going to have a huge impact and your health.
Yeah. Yeah.
And health is our most prized possession, guys. If we don't take care of it, it doesn't matter how wealthy we are. We talked about, it doesn't matter what you have. It doesn't matter. That's the one thing that we need to take care of to make sure that we enjoy life and everything that life has to offer, for sure.
Yes. And I did put that book, the name of that book, in the chat. So if you guys are interested in something like that, it's only like $17 on Amazon. I was just checking that out. So that I think that is something very encouraging. It's also a good gift to give somebody if they are going through cancer or having that cancer scare. And even if you're not going through cancer, we all have something that gives us a little bit of anxiety every once in a while. So it's just something great to give away.
Yeah,
so,
and that was a gift for me. So it was given to me, and amazing gift for sure. And guys, talk to people. Cancer is a weird thing. Like, we can shut down or diagnosis, and sometimes it's harder to talk to somebody that hasn't gone through it. You'll find that you'll connect with people that have been where you are, and they were a great source for me to sit down and talk to. I mean, a lot of my friends reached out that had done that, and just being able to talk about that experience, because it feels so surreal, sometimes.
right. Yeah.
I can tell you that I felt the best the moment I did my live and shared my story. And I was a little scared to share my story. And it was another friend of mine that did a live that I said, you know what, we need to spread the word. We need to spread the word about prevention. We need to spread the word about self-care, which is what you do, Tracy. Is so important every single Saturday, actually every day of your life. every hour that you're awake, you're doing this, but especially on your Saturday shows, because we can help so many people, take fears away. You were talking about prevent, what questions. Well, if somebody's going to a mammogram for the first time, now we have the Google machine. At least Google, is there any questions that I can answer? What do I need to be prepared? A lot of times people don't want to know. They just want to do it. I'm the kind of person that wants to know what's going to happen. And maybe that's the anxious person in me. I want to know kind of what to expect.
Yeah.
Yeah.
And I think that's important. It takes away some of the anxiety when you know what to expect. Like as little kids, we always teach for parenting, and I always teach parents to have routine and have some structure, because kids want to know where we're going to go, when we're going to go, and they want to, kind of have that every day at the same time. If they're expecting it, you best be doing it or explaining beforehand that, okay, we're not going to do that today. We're going to do this instead, or otherwise you're going to get that. So when are we going to get there? When are we going to do this? How are we going to do that? All that kind of stuff, and all that does is raises our blood pressure and gets us going.
No, right.
Sometimes it's not good for us, especially if it's something that we really don't have to be scared or anxious about, right? Mm-hmm. But one of the big things I want to know too is, how did you know to go to a naturopath oncologist?
Well, my friend Carrie, who popped up and gave me this book, I have so much. She comes to my Zumba classes all the time. And I know we've done a Zumbathon in the past for breast cancer awareness. We hope to do another one when we can gather, more people, because it's so important. But that's kind of in my radar. Like, I am aware of, because of what I do and helping people remove toxins. I've always been kind of East and West, right? When as far as medicine, we got to understand that doctors in general, they're not nutritionists, right? Doctors, like a boob doctor, even, they're meant to remove the cancer or deal with it. A general doctor is they need to know about maybe medications. They need to know, a heart doctor needs to know about heart health, but they're not into nutrition. That's not what they go for unless you're going to a nutritionist or somebody that knows about this area. So you have to be very well versed in taking care of your own health and asking questions. So that I'm already in that realm. I think my friend Karen and I were talking about that maybe 80% of the people are not necessarily in that. And I'm one of the 20% that is very aware of, I go to a chiropractor, if there's a natural alternative, I will try that, but I'll take conventional methods and natural methods. I think that's the best way to be. I think when we go to extremes, and we can talk, we're not going to talk about politics or religion about this, but when we go to extremes, it's really weird, right? So we got to understand both sides. Or even, let me say this, I'm kind of rambling. Decisions should never be made out of fear, right? If we make a decision, we want to know the pros and the cons so we can make a decision that feels comfortable, not a decision that is fear-based, because then you'll question a lot of those decisions. And we're not in the right frame of mind if we're fearful about a decision. So again, Carrie recommended this clinic. She's had experience with this clinic. Interesting. They're 4 miles from the house. And I pass them every day when I go to the gym to teach, or every 3 times a week when I go teach. So I think it's asking questions, and I didn't necessarily ask, but my friends know kind of what I do. And so it was an easy conversation to have. This is why I want to make it aware, because there's options, right? There's options, and we need to be aware. And they do therapies that can even be done, if you're comfortable with it, in place of chemotherapy or in place of radiation. And I'm not saying that that's what you should or shouldn't do, but I need to make sure people know that there are options in whatever you're comfortable with. People.
I'm glad to know that there are therapies and things like that. And I think that's something that we have to share with our younger people too, is that, if you are diagnosed with something, or actually probably wait until they may be diagnosed with it, instead of, because I find like when people start asking, so what if this and what if that, they're already working up that energy in their body that's probably not necessary yet.
Yeah, but what I will say, Tracy, that's super important is that if we do things to improve our health, then we're doing prevention so that we don't get a diagnosis. And again, I can't control everything I did in the past. I mean, literally in my younger days, I smoked for about 15 years. That doesn't mean that I got stage 0 breast cancer because I smoked for 15 years. But you know what? I did. So I can't go back and change when I was 20 years old and not do that. Exactly. But it is a risk factor, right? So it's not, shame on you, or this is nothing like that. But it is there. We do have control of how we take care of our bodies so that it's at optimal health, so that we don't we're not faced with disease. When I was getting my lumpectomy, I'm going to tell you a very vivid vision that I got when I was waiting. And my procedure was 30 minutes. I chose not to have general anesthesia because it was smaller and I had low food. And I sat there because my doctor was behind, and I listened to patient after patient with a curtain being on dialysis, having all these surgeries because of diabetes and high blood pressure and all these different things. And it just reassured me that I'm doing the right thing by not only taking care of my body, but educating other people to take care of their health, because we don't want to be the dialysis patient at 50 right next to you. Right. I don't want to be that person that has diabetes. I mean, all these things increases our chances of getting cancer, which is what we're talking about today, specifically breast cancer. But we do have control of a lot of this. Some environmental things we may not have control, but most of it we do have control. And just know that breast cancer, 85% is not related at all to family history or genetics. So you're in control of getting your testing. You don't have to have had, somebody in your family. If you do, it increases the chances slightly. So make sure that you're screening for sure if there's breast cancer, especially first, what do they call it? First degree, mother, a sister, a daughter.
Okay. Yeah, that's good to know too. So yeah, I'm glad you said that. because we don't have a history of that in our family. But I could see somebody saying, well, I don't have a history of that, so it's probably not going to happen to me, and then never go for a mammogram or anything like that.
Yeah,
But
and I'm
thank
adopted.
you so much.
No, the history, because I'm adopted, but I think I shared earlier that my birth family found me over the summer, which is so funny how things happen, right? And one of the first things my birth mom said to me was, there really isn't breast cancer in our family. It's funny that she felt the urge to say that because a few months later I was diagnosed with breast cancer. So it was
Oh,
interesting. So just don't let that deter. It's not, and I don't have genetics at all for it. And only however percent it's 5 to 10% is hereditary only. So just know that. And most of them are not genetically either influenced. I don't have the BRCA gene. If you have the BRCA gene, there's more drastic measures that people tend to take because it is highly happens a lot in families. But anyways,
yes.
we can talk about this for days, but at least if we get things to people, take care of your body, take care of your health, and screen your tatas, please, 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 and post. Let us know if you haven't when you did the appointment, just like Tracy did. Proud of you, sister, and share with others that you did, because
Well,
that makes
thank you
they've
for encouraging me in that, because when I saw your post, I was like, oh shoot, I've been meaning to get that done, and then I scheduled it and didn't go. But this month is like totally so free on the weekend, so I'm like definitely gonna go, and so it's definitely on my radar, and I will be doing that. So you guys, do me a favor.
not while they're getting the mammogram, but post the picture in that you did it, because I think there's something powerful when we see other people go and do it, right? And it doesn't have to be a picture of you, just saying, hey, just got it done, because it's going to remind somebody, because your reach may be different than my reach. And the more we spread the word, the more people can prevent it and catch it early. God forbid if that happens, and be able to deal with it in a lesser severe way than a more dangerous diagnosis. Yeah.
For sure. And since you guys know I'm getting mine done on a Saturday, I will be able to tell you that in video, and hopefully I'll be saying I got a great report. Everything came back just fine, or something of that sort.
Yep.
So you can hold me to it and let me know too, if you get diagnosed with that, because we definitely want to be encouraging you and lifting you up in prayer. Most of you know I'm a big proponent of prayer. I know the power of prayer really works. I truly believe in that. I know God is real, and yeah, he's not a man that he should lie, nor the son of man that he should repent. So he is definitely real. He's definitely a healer. But I want to thank you all for joining today. Thank you for staying so long with us, hanging in there with us. But be encouraged. It's the beginning of the year. And I think Annette mentioned it a little earlier about tiny habits. If we start these tiny habits right now at the beginning of the year, then hopefully we will all see each other again at the end of the year in December 31st. I want to see all of you guys. It's just really important to me. So with that being said, if you haven't put your company in the box, make sure you put your company's name in there. And one of the things, remember that if you are looking to do some healthy stuff in your household, reach out to Annette Dela Cruz. Dela Cruz, I like that better, because she does have Melaleuca products. We use them in our household. I know that it works, and so reach out to her even just to learn about how that can help.
Importantly, just I want to educate you on what you can do to change whether you use Melaleuca products or not. So I'm an educator first. So if you want to know what you can do, I will, give you a 15, 20-minute kind of education on what you could do that has nothing to do with you necessarily being a Melaleuca customer, but it's just about education on what you can do. So that is my passion. So I'm here for that.
Awesome. All right, you guys, enjoy the rest of your day. Be blessed in the rest of your week as well. Thank you again for joining. I love you guys. Have a great rest of your day. Peace out.
Thank
Perfect.
you.